so this treatment today is PRP, or platelet rich plasma, and we're doing it to help in the regeneration of the hair follicles where there's either hair loss or especially as men, as they're starting to see their hair recede, this is a great time to actually use the therapy because the hair cells, the hair follicles have just gone into a dormant state.
Yeah.
And so we're just trying to like bring them back into that active growing.
So waking them up.
Exactly. Yep. Waking them up and just kind of getting them to get out of that dormant stage and into that growing stage again. So it works best if there is still hair in the area.
Yeah.
Not so much if it's completely shiny, because that means that the hair follicle is completely gone, rather than just in that dormant state.
Right.
All right. So with PRP, it does stand for platelet rich plasma. It involves drawing blood from the patient, from their vein, and then we'll show here as well that we spin it down, and that separates the red blood cells from the platelets in the plasma. And in that plasma, or like the liquid gold, as I like to call it, and you'll see the color of it as well. It has the platelets, which are great for rebuilding. It has the white blood cells, which are very helpful for the rejuvenation. It also has growth factors and stem cells from the patient's own blood.
Nice.
So you use your own blood in this case. When it's used for aesthetics, even with like the small amount of like micro trauma from the needle, that also is just stimulating more circulation so that more blood flow goes to the area and is also bringing more cells.
Nice. So, and it has to be your own blood, it can't be somebody else's.
It has to be your own blood, yeah, because there's too many other factors that can go.
Cool. And how much blood do you need? Is it different for every...
It depends on the machine.
Right.
Yeah, so if you're, with the kits that I have, it's 22 mils of blood, usually, for a hair. If we're doing like an aesthetics, yeah, maybe like 10 to 22,
Right.
depending on how many areas.
And so to put that in perspective for somebody that maybe gives blood, how much would be giving blood in milliliters?
I think it's a liter, so a liter is 1,000 milliliters.
Okay, so barely any that you're taking.
It's a tiny amount, and you'll see it just fills up this container here.
Okay.
All right, you ready?
I am ready.
Okay.
So since we're doing the hair, like you sent me all the pre-stuff, so I washed my hair today and didn't put any products in it.
Excellent.
But
Yeah.
I could have done it yesterday too, right?
Yes. Yes, the day before or the day of is great, as long as there's no product. The reason for that is when we're doing the injections, we don't want to have anything foreign going into the area. So, we'll just do this. Okay, and you can relax your arm. And then just make a fist. Excellent. So I'm going to sanitize the entire area. Make a nice clean field. Okay, ready?
Ready.
Poke. Excellent. And you can relax your hand. And as you can see, the blood is filling up into the vial here. How do you feel?
Fine.
Good. You can tell you did a workout. It's going nice and quick.
Yeah. My circulation's great.
That's still good?
Yeah.
Okay.
That's why I'm sweating.
And then the best thing about these cartridges is when we're full, it's done. Alright. There we go. And then hold pressure.
That was easy.
Good. So now we have the blood in the vial. We just move it a couple times up and down, and that just allows for the, there's a little bit of like liquid in it that just helps in making that separation between the red blood cells and the plasma.
Right. So the healthier you are, does it make make a huge difference or not? Like, say I was really unhealthy habits.
Yep. You may see more. You may see more like fat in the blood, or it may just be like a little bit cloudier compared to a lighter color. You can tell if somebody's eaten a lot of like fatty meals right before, but sometimes like the good fats also make it look a little cloudy too. So you can't base it on that. But I'm actually glad you asked that question, because if you want a really good result from using PRP, you're only going to be as healthy as your blood is. So if you don't have healthy blood, you don't have good healthy cells, you can't expect when we then isolate those cells and re-inject them into an area to like repopulate as new cells to help in an area that we're asking to in the cell. It's not going to help as much if you're not as healthy.
That makes sense.
So now we're going to put the blood, after we've mixed it around, we're going to actually put it into this little container, and this will go into the centrifuge. Here, like that. And we close that, and we spin. It's going to spin for 10 minutes, and then we'll be ready to go. Well, now the centrifuge has finished spinning, and as you can see, we have a separation between the red blood cells that are on the bottom, this layer which separates them, and then we have the plasma on top. So the plasma with the platelets and all the growth factors are in this solution. And it's kind of hard to see, but there's like a slight cloudy layer on the very bottom. That's a more condensed or more concentrated version of the platelets. So what I'm going to actually do is take out a little bit of the plasma before I actually mix it all together. So just going to take out 3 here. And then we want to mix it all together. This is what we call the liquid gold. So this is now the platelet rich plasma, and this is going to be the platelet poor plasma, because we've mixed the platelets back into this.
So why do you take out the little bit at the beginning?
Just so that this then becomes more concentrated, so that we want to use that in the areas that are the most, that we really want to promote. So that'll go right along the hairline. And as you can see, you may not be able to see it on here, but you can see a little, like platelet, or a little like fat bubble in there. I don't know if you can see it. But anyway, there's also a difference in color between the platelet rich and the platelet poor.
Ah, yeah. It does look gold.
Yeah.
Goldy.
I love gold. So, good. Now we can use this. And I want to make sure that I get all of it. There we go. And so now we've taken all of the plasma out, and I can just go there. And then that's the difference in color. Platelet rich, platelet poor. We'll still use them both, and they're both still have platelets in them. It's just it has more in here.
Ah, okay.
All right. Ready. It's alcohol first. Give it a little scrub. Go.
So, and the day before, or a couple days before, you said there's no alcohol supposedly, and then no smoking and stuff like that. And why is that?
Yeah.
It thins your blood, or?
So alcohol will thin the blood, and also alcohol causes more inflammation,
Right.
and so it can make it hurt more, just with the pokes. Also, what else did you say? Oh yeah, smoking. So smoking really takes down collagen production.
Oh, okay.
And smoking just in general really slows the body down in the healing process.
Right.
So when it comes to like joint and ligaments for PRP, I usually won't do them on people that are smoking or smoking a lot.
Right.
If we can even like cut them down in order to like get themselves healthy. Again, it's really, you're only as healthy as your blood.
Right.
So no smoking, no alcohol, yeah, because it also thins it, and then it bleeds more and then it bruises more.
And then also, did it mention something about like no Advil and?
Yeah, so Advil is an anti-inflammatory, and when we're actually doing these hair treatments, we're actually trying to promote a little bit of inflammation, both with the pokes, the needle pokes, which cause a micro trauma, but also these cells. These cells are brought to an area when there is inflammation, and we want that to be controlled inflammation just in this area to help heal up.
Right. Okay.
The follicles.
So, and since it's summertime, do you say avoid the sun for the next day, or?
Just be a little bit, you may be a little bit more sensitive. It's, just don't go and like burn your head.
Right.
So you can wear a hat, that's no problem. Usually when I'm doing PRP treatments, I'll also get people to do vitamin injections just to really like boost up nutrients in their
smart.
cell. And then, yeah, wearing a hat is fine. Sometimes people will take like an oral or a topical medication as well. But the PRP is really just taking those cells that we want to help heal that area, and putting them into the area that they want.
Right.
So I usually do one treatment every 4 weeks, 4 to 6 weeks for hair treatments, because when we're putting our own platelets, it takes about at least 3 weeks to a month for those cells to actually get into their new position.
Oh, okay. And then how many treatments on
I
average?
usually say 4 to 6, but we always are like reassessing. Sometimes people are starting to see that hair growth, and then it kind of continues to grow, and as it's getting longer, you don't see it right away. You usually need at least 3 before you're actually even seeing that hair sprout.
Perfect. So it'd be perfect for fall time.
Perfect for fall. Yeah, luscious. All right, are you ready?
Ready.
Okay. Let's go towards me. Okay.
Yep.
So I'm just doing little tiny blebs, or like little pockets underneath the skin, right down into that hair follicle. And the thing about, you good?
Yep.
The thing about the fluid though is it's not just where you put it, like it will move around.
Right.
So it's not like you have to get each hair follicle, in case that's a question for people. But we just want to like saturate. And so as you can see, I'm going right into the hairline. Okay?
Yep.
How's it feel so far?
Feels like an allergy test.
Yeah.
Like, you know, when you have them on your arm.
Yep. So, and I'm actually going into where the hair is as well, because that's also going to just promote the cells around it, especially in thinning hair. It could be like one hair follicle is promoting or has that hair going, and then the next one could be in a dormant phase. And as you can see, there is some blood in it, but that's actually good because that's also going to promote collagen and more, it's good for circulation as well. Sometimes people find one side of the head more tender. If you need a break, let me know.
It's fine. I have this massive tattoo. It was probably more painful. The lights are blinding. So I'll just close my eyes.
Yes, I should be good. So I've gone all the way around just the initial hairline. I'm just going to go into this side. So this can be done for both males and females. Usually when somebody comes in with like a complaint of hair loss, we're also looking at like what their hormones are like. That can really, hormones can play a huge impact, as well as iron levels, as well as thyroid levels, as to why hair may be in a more dormant phase compared to the active growing phase. But thyroid's a big one.
I didn't know that.
I'm gonna turn your head that way. And then also women, like right after babies, because of different hormones, have can sometimes lose hair. It'll be really luscious during pregnancy, and then the decrease in hormones, the hair is released. Sometimes one side can be more painful. Just this side. Definitely don't expect a nice hairdo when you're done.
No.
Almost done. I'm just gonna change the needle.
So for men, when we're losing hair a little bit as we get older,
Yeah.
you mentioned thyroid. Does our thyroid change a bunch then, or is it because of our testosterone? Or
It is as the testosterone decreases. And also estrogen increases slightly. But it can also be genetic factors, and hormones. But thyroid can also play a role, and so sometimes if it's that is also something that we're looking into. I'm gonna turn her head. So as you can see, I'm just going even into like the part, because that's where we're still trying to promote, even though it may be thinning, we're trying to increase the amount. And get those hair follicles moving.
so will it be as luscious as my beard?
Your beard is doing great.
My hair is moving from the top of my head to my chin.
Yeah, it's gone through the face. So some people will do less injections, like bigger blobs. I find kind of spreading it out, I've had more success with it. Almost there. And again, it's about making it even.
Right.
So as David, I don't want him to feel it, but you know, there's little like blobs underneath the skin into the hair follicle, so that's why you'll just see me rubbing a bit to just smooth it in. Do you notice any at the back?
Not as much.
No. Okay. Just read all the parts. Last one. There we go.
Yeah.
All right. So that's all the PRP. What I'm just gonna do is, because there's now the holes,
Yeah.
or like the little bit of, I'm just actually gonna squirt some of this platelet pore plasma
Oh, smart.
on the skin and the scalp, because using this and rubbing it in will still get into the cells as well and just give more nutrients.
So aftercare, what is the tips and tricks?
Yeah, so not washing your hair right away, dyeing your hair. Just, we want to let it at least for 3 days, just to allow all the holes to close up. And then no Advil, because that'll decrease the inflammation where we're actually trying to promote it. And other aftercare, make sure you're staying hydrated. That's super important. And
So can I put gel in my hair tomorrow, or
you
product?
can tomorrow. Yep. Yeah, that should be no problem. I'd kind of leave it off today if you could.
Yeah. And then no alcohol again.
Yeah, I usually say at least for like 3 days. There you go. So your hair will be a little bit, well, it's full of PRP. Yeah. There we go. There you go. So I'm just gonna leave that like that, and you can get up.
Sweet.
So.
Am I sexier already?
Oh yeah! Wow. It's just
Look at that.
lucky. So David's hair looks amazing.
Yeah, this is what I was going for.
Yeah. Totally. So it's totally normal for there to be blood. Heads have a lot of circulation to them.
Yeah.
And so there's little vessels all through the scalp. So there is bleeding. Most of the time I tell patients like that before as well, just to not be alarmed.
Yeah.
But that's why we use this and throw it away, and yeah. So how do you feel now?
Wicked, same as.
Yeah.
Yeah, it wasn't that bad. Just feels like little pinpricks, really.
Yep.
And then on some of them, it was just sounded crunchy.
Yeah. And so that's actually because there's like fascia and different layers over the scalp.
Right.
And so It's just as it's kind of going through that like fibrous layers,
Right.
It can sometimes sound a little bit crunchy. And it's right by your head, which is right by your ears.
Cool.
Yeah.
So if somebody's doing research on this, what else would they be researching? Because they might be nervous before they come in, or...
Yeah. So PRP, or platelet rich plasma, hair loss. They could be looking for losing hair. These are all things to also see a naturopathic doctor about even before we go to injection therapies. There's many other different things we can do from, as I said, looking at hormone levels, looking at what stress levels are like. Usually after a stressful situation, it's about 100 days for that hair follicle to actually, with that extra stress, to actually let go of that hair. So sometimes people will see that hair loss at a time that their stress may be better by that point, but they've had a stressful event
Right.
previously.
That makes sense.
You're also going to lose more hair in the summer, just as we're like shedding. But if there's a huge difference in how your hair is normally, then that may, be a hormone issue or some kind of other issue that we need to look at before we're going to using this treatment.
Right. And then how can people find you?
So I have my website, which is www.drheathernd.com, and doctor spelled out. I also post on Facebook and Instagram at Dr. Heather ND.
Okay.
And then my 2 clinics, I have Kinetic Patterns just across the street from Vancouver General Hospital, and Divine Elements here in Kitsilano.
Perfect. So if people are just in the processing, wondering phase, can they still contact you?
Absolutely. Yep. I'm happy to do a 15-minute meet and greet consult, which we can just discuss what treatments are available. I don't give treatment advice in those, but if you're looking to do it, then we'll have an appointment. I'll take your history, because it's so important to also know the patient's history before we go in doing a treatment like this, and also just know what else that we could have to also work with.
Right, that makes sense. Cool. So thank you so much.
You're welcome. And so then again, follow up in about 4 weeks.
Okay.
Vitamin IVs are a great way to just kind of keep promoting those cells, because now that we've put those cells into the scalp, it takes about a month, 3 weeks to a month, for them to actually, as stem cells that don't have a role yet, to gain their new role.
Right, that makes sense.
Yeah.
Cool. Awesome.
All right.
Thank you so much.
You're welcome.